Hello everyone, this is Team Sky and we are presenting our Midgard AGVRover in order to improve the hospital sanitization and improve the revolutionizing. I would like to start with like our problem statement. So basically this we found out that some places, some hospitals, they have shortages of staff, and at the same time they have problem with like keep the sanitizing process the whole time due to the like a heavy schedule, and sometimes we found out that those in places that where basically clinics are not that advanced, they have next issues, as you can see, staff shortages and manual cleaning inefficiencies due to problem. For example, people are using the same clothes, etc., or the same thing. So basically, and there is the hygiene level is not qualified enough. Moving on to the high risks of healthcare associated infections, simply as we have seen in COVID-19 and the previous pandemics, there were like an issue with contaminate viruses or like different kind of germs due to its own character. And moving on to the urgency in to address the gaps in infection control, because without knowing what we are fighting, we are having a problem to close the gap. So every time we need to like use something or the facility at the hospital or any kind of medical health care, it need to be sterilized and sanitized at the same time before being used and after being used, in order to keep the hygiene level at its own highest level. Moving on to our solution overview. So simply our Midgard rover focuses on an automated cleaning process and disinfection, and at the same time with reduce the infection risks with enhancing the efficiency and reduce the staff workload. So simply, many staff, especially in the sanitizing like departments, they have a problem with like keeping like especially the cleaners with keeping the hospital always clean due like for like a short time of usage. So simply they might use an operating room and after that an operation room and after that uh, just for a few minutes. And as we know, any kind of medical room, especially ORs, emergencies, etc., it need to be sanitized every time it's being used. Moving on to our business model canvas. So our key partners are basically an AI developers, hardware manufacturers, and hospital. AI developers were basically they are going to help in developing the product and improve the product scalability from the AI side, and at the same time help in achieving premium advantages of the AI usages in these days, especially in navigation and etc. etc. And this kind of rover need to have the capability to adapt, identify the objects around it. Moving on to our hardware manufacturer assembly is basically some kind of hardwares need to be scaled to like work a bit extra over others. So simply, sometimes some things can go down just because of not enough capability of resisting or hold the workload. So simply, we need to use like specific materials or equipments in order to achieve that, and hospitals to provide us with the chance of navigating and use the surrounding in order to understand and let the system understand the surrounding. Moving on to our key activities. Our key activities is basically based on R&D, production and testing, and deployment and maintenance. So basically in R&D we go and like basically research and develop the product and look into what do we need to add to the product. Moving on to the production part, where basically after we have researched the product and we have like developed as much as possible into this product, now it's the time to produce this product. Once the product is existing in our real life, we move on to the next stage where basically we have like to test the product. So in order to know whether if the product is working or not, or the product is a successful product or not, we have to go into different testing levels to ensure that the hardware, the software, the product is capable to identify the surroundings and move on around. And if it's not, then we have to go again back to the R&D and start like try to identify what's the problem. Once the testing level has been done, we move to the deployment where basically we will take this product and like start deploying the product into different places. So since we are solving something in a healthcare facilities, we are actually trying to reach healthcare facilities and try to convince them to try and use our product. Once they are convinced, then we can move to the and the product is deployed into that area. Now we can move to the maintenance, where basically we have like a scheduled or like depends on need maintenance level, where basically we go and check each robot have been created and try to find whether if this robot needs to have fixed or like sometimes change some materials due to the like work, let's say injuries. Moving on to the value propositions. So simply the product has a three main values propositions, as you can see. First, the efficient hospital sanitization. This is our first aim and goal. Moving on to the to reduce the HAIs. Simply make sure that the healthcare facilities doesn't have any infections and it's not an increase as like previously, especially due to the human error. And lastly, it's scalable for those hospitals or places that it's far away. Like let's say it's in somewhere in the mountains or like in a villages where basically having this sanitizing is cleaners is an issue over time. Next, our customers' relationship. So simply, they're going to be a direct partnership with the healthcare facilities. So what we are looking for, since this product is for healthcare facilities, they're going to be like an immediate like contact with like healthcare providers, hospitals, the government. Depends on like those who works in the healthcare facility and what kind of level they need it. Moving on to the to our customer segments, as we can see here, we have decided there is two main customer segments. Hospitals in very far places and basically urban, like in the farms, I mean like in the villages, stuff that somewhere in the mountains and like let's say deserts sometimes, depend on which area. Secondly, a clinic and medical centers can be in the city, which basically it's easy to reach for cleaners, but they have a heavy schedule, so basically they might need an extra help. For our channels, they're gonna be like three ways: either direct sales, which is from business to business, B2B, or healthcare exhibitions where we go and provide the product and show it to those healthcare providers or hospitals or anyone who's like holding an exhibition or participating in an exhibition. And finally, with the government tenders by making it a bit over popular on social media, where basically we can attract the government attention in order to fund this kind of project and help us to advance this project. As a cost structure, the cost basically it's depending on the manufacturing and software development and the maintenance. So simply for the manufacturing, until now, since we are working on a prototype, the price is still around like 1,000 to 2,000. This is depends on the like products that have been used. For example, the UV light is a bit like overpricey compared to other components and other like the motherboard, etc. All of this related to the hardware part is simply considered as like as a must. Moving on to our software development. Basically, the software development is really important because we are talking about paying humans in order to do the software development, and at the same time have like a qualified work through a qualified people. So if we need a qualified work, we need professionals to work on it. And definitely they will be asking like in different ranges. And I'm talking about if whether if it was like let's say freelancing is gonna be like $100 maybe, something like this per we are talking about like per day or task. Lastly, maintenance for this part, where basically the maintenance costs can be depend on the like the maintenance team availability, and at the same time which part is actually damaged. So all of this can be later let's say identified. Moving on to the revenue streams. The revenue streams is based on the initial sales and maintenance contracts and upgrades and customization. So perhaps, first of all, let's say they will buy the product, which we call the initial sale, which simply you go and you buy the product and you have the product. The second one is the maintenance contracts. Definitely after buying the product, this product, like any another product, like water filters, like for example, solar panels or this kind of stuff, needs to have a maintenance contract. So the maintenance contract gonna be like valuable from few years with the warranty absolutely, and can be renewed maybe later, depends on the condition of the robot as well. And finally is the upgrade and customization. So since this is the first version and simply it's just a prototype, but then later when we are working on different like products, when we are talking about products instead of prototype, we can be talking about like customizable upgrades. That's, let's say we can like put better processors or a better like for example shape design that can be fitting to the hospital without being annoying or something like this. And we are also talking about the part where basically like we can add some extra hardwares once we start developing, like for example thermal sensors and this kind of stuff, in order to identify other objects or objects that produce heat. So the unique features that we do have right now: navigation, GUI, scalability, and remote control. Navigation, we have built an AI sensors and camera for a precision object identify using an OpenCV. Moving on to the GUI, where basically it's an intuitive and user-friendly interface, can be controlled from the device itself. We are working on making it like a bit broadcasting, and the scalability basically is a part of the customizable for drivers, diverse healthcare facilities. So it can be changed as previously we said. We can develop and do some upgrades on it. And the remote control basically is operable via VNC for troubleshooting. As a market potential, our target marketing basically hospitals and clinics, and the public and private sectors. Okay, simply we are looking as a target market, we are looking for the shark and the whale in the market in order to attract them to attract other whales as well to help us and develop this product and increase this product the highlight on this product, and show them that this product actually is a valuable and valuable, and at the same time important. Otherwise, we have to go to public or private sectors. We are talking about places where simply they still need sanitizing the area, like in industries, but it's very rare to have like these places and open for like public. Secondly, global demand. Definitely, there's going to be increased focus in infection and control especially post the pandemic, and we are talking here about COVID-19. So once it's actually showing a very uh, a very efficient in this sector, okay, and show increase in on a local scale, we will start to attract nearby countries, and I'm talking here about places like Singapore, Thailand, first of all, the Southeast, like the South Pacific area, and after that, moving to different places, like for example, in Europe, with a cooperation with another companies and finally, the market gap to find the affordable and scalable sterilizing solutions. So simply, there are some solutions, but they are actually a bit overpricey, and hospitals they don't want to spend that much, especially those which is in isolated areas. So they don't want to spend a lot of their budget into this. So as our objectives to develop a customizable AGV for diverse healthcare settings. Secondly, achieve a real-time AI-assisted navigations. Thirdly, ensure the cost effectiveness and easy to be operated. This is our objective for this product. Three, to develop a very customizable AGV to achieve a real-time AI-assisted navigation and ensure to be an cost effectiveness. Moving to the opportunities for innovations. So simply, AI and automation advancement enables the error-free sterilization and raising the acceptance of robotics in healthcare facilities. There is robots in healthcare facilities, but these robots are only into the operating part, where basically they are run by like professionals. But this kind of robot must be around areas like where basically we are talking about the waiting area, the places like patients room, this kind of places that have people who's not sterilized or not contaminated yet. Our expected outcomes simply is to have an enhanced infection control with a cost-effective sanitization and reduce the labor dependency for hospitals and especially in isolated areas and with a higher user satisfaction. As a conclusion, I would like to highlight those three main points. Midgard AGVRover is a transformative solution for modern healthcare facilities and addresses an urgent sanitation needs with ensures the patient and staff safety while optimizing the hospital operations.